I'm Dr. Frank McGeorge with the Emergency Department at Henry Ford Hospital main campus. I'm also with Channel 4 WDIV as their medical reporter, and I'll be going to Haiti on both a reporting and a medical mission. Right now there's medical relief pouring in from all across the world. In my case, there's a couple of purposes. One, I do want to provide medical care, and I'm able to do that with my training in emergency medicine, but I'm in a slightly unique situation because I am a reporter as well. Hopefully I'll be able to see and relay back some of the true devastation and degree of illness and injury that exists there. It's our expectation that when we get there, we'll be able to either link up with an existing clinic or that we'll be able to set up our own clinic. But either way, I'm collecting all the supplies to be self-sufficient so that I don't rely on anyone there, because I expect that there won't be any availability of supplies to help me practice medicine. Well, this many days out, there are going to be several different types of injuries. The biggest one are going to be cuts, fractures that weren't treated, sprains that may be getting worse, but we're also expecting a large number of infections. So I have brought antibiotics that are injectable in that case. We're also potentially expecting that if someone were brought to me that was recently taken out of some rubble, they would have a crush injury this many days out, and they would need IV fluids, and then they would need to be evacuated to a place where they could get more definitive care than I would be able to provide unless I can find myself a hospital or a large medical facility that's already up and running. Going into a disaster area is always going to be difficult because we don't really know what to expect. We don't know what the needs of the population are at this point, and in some ways we're putting ourselves at risk. So I'm also prepared that I have to take some antibiotics. I have also already received some vaccinations to make sure that I don't become another casualty of the earthquake. We need to be able to go down there and be completely self-sufficient. Our own food, our own water, our own shelter, and our own medical supplies, and we don't want to become sick while we're down there and not only find ourselves useless, but find ourselves a burden on the system.